So that's the range. That's a lot of functions, right? So one word about young versus old MSCs. So part of my mission is to find out what's the best source of stem cells for patients, because there's so many things out there. There's so many claims, and people use fat derived, bone marrow derived, and umbilical cord derived. So when I came on the scene, I was like, all I wanted to know which one works the best. That's what I want to do, because whichever one works the best, that's what I'm going to do. So I went on a mission to find out. And some of this information is accumulated when I was trying to find out what's the research all around the world about the differences between different kinds of stem cells. So I actually have a lecture on YouTube. It's called Are All MSCs Created Equal?, where I went into great depth about these different sources and comparisons. But just the words on young versus old MSC. So, all of us here, we're mature adults, our MSCs are a lot older than what's in the umbilical cord, right? The birth tissue when we're born. So does age matter? The fact that these MSCs are in us our entire lifetime makes them very susceptible to accumulation of cellular damages. So the longer we live, the more we accumulate these damages. So that can lead to cell death, senescence, loss of regenerative functions, or even cancerous changes, neoplastic transformations. But neonatal MSCs, so these are very young birth tissue. So Wharton jelly is a portion, it's a part of the umbilical cord, and they're spared of these pro-aging factors. So some other evidence, when they looked at aged adipose-derived MSCs, so these are fat-derived MSCs. So what they do is that when they extract the fat, it's not that the fat has any MSCs, it's the blood vessels that are supplying the fat everywhere. They're getting the MSCs out of there. And so these are significantly compromised when a person is older. So they were looking at, when they use these, they were unable to support repair. So age-associated impairment. So when we get older, we have less ability for wound healing. And so they were not able to improve wound healing any further, because they are just that's all they can do. And when they use bone marrow derived MSCs, they also show that they have less myogenic potential, so less ability to form muscles, and less capable to engraft, staying in the donor, in the recipient. Then developmentally early MSCs, so they, older MSCs have less differentiation potential, and less ability to stay where they're transplanted. And bone marrow derived MSCs also exhibit age-related decline in inflammatory response and other type of responses that are important for the MSC's migration and activation and their capabilities. When you look at genetic material in adipose-derived stem cells, they do decline when we age. So there's senescence, genes that express that the cells are becoming older and senescing, and that increases with age in these adipose-derived stem cells. And aging also alters capabilities of these cells, of adipose-derived stem cells, to form blood vessels. And there's also increased level of reactive oxygen species in bone marrow derived MSCs, in aging bone marrow derived MSCs. So not only they have increased level of these reactive oxygen species that can cause damages, they're also more sensitive to the reactive oxygen species that's in the environment. So it's double whammy. So they have increased levels and they're more sensitive. So they're more prone to damages. And young MSCs from year 1 to 5 outperformed older MSCs from somebody that's age 50 to 70 in improving cardiac parameters. So after heart attack, if they try to treat the patient, the younger stem cells will lead to better results, better improvements. And then MSCs from young individuals can undergo neural and ectodermal differentiation. So that's the, basically all the neuronal lineage differentiation. But when you use bone marrow stem cells from an elderly patient, they lost that capability. So their ability to form maybe neurons, that has been lost when you get older. And from another study, adult MSCs are exposed to a lifetime of factors, of things we do to our body, including something as benign as NSAIDs, anti-inflammatories we take. And that the NSAIDs can inhibit MSC's capability to form cartilage and bones. So, we're all exposed to a lot of toxic factors, whether or not we like it. Lifestyle factors also affect MSC, something like a high-fat diet. So they showed high-fat fed mice have higher, so these cells tend to differentiate more toward fat rather than more toward endothelial, so the inner lining of the blood vessels. So it changes where they want to go and who they can become. And when you look at obese patients, their ability to form bones, the osteogenic potential, are impaired. So when you look at their MSCs, they're able to, the nodules and mineralization they can form is fewer and smaller. And, metabolic diseases, changes in environment that adipose-derived stem cells are in. So these cells can lose their capabilities to form vascular network. They've shown that both in a petri dish and in live animals. So, we all know the obesity rate and how, and diabetes, 8% with diabetes in the country. So all these are factors when we consider using stem cells from our own body. And aging also can lead to decreased bone marrow mesenchymal stem cells. So bone marrow have, about 0.1 to 0.01% of mesenchymal stem cells, so not that much to begin with. But when you age, you start to lose more. You just have less and less mesenchymal stem cells in your bone. And that could be one of the reasons for osteoporosis, because these mesenchymal stem cells tend to differentiate more into fat cells rather than bone cells. And when you transplant young MSCs into the bone marrow of old mice, not only it rescues the bone loss, but it also delays aging. And even if you do it subcutaneously, so even if you just put it, in the skin layers, you inject into skin layers, that can also suppress age-related degeneration of various organs. So my goal is to put the cells somewhere in the body, because once it's in the body, yes, if you put locally, we're treating local problems, more will stay in that area, but some will also, always end up somewhere else, because, this is a fluid dynamic system. So as long as you put, even for, when I do stem cell facial, I inject stem cells into the skin layer, the key is to get it in there, and then the cells can do its own work. So like they say, you can here, even subcutaneous, it can delay some of the degeneration associated with aging. And so aging of MSCs is also detrimental to things like your hematopoietic system, so your whole blood forming system. And aging compromises the therapeutic potential of these MSCs, including the cells from not only people who are older, but also when you expand the cells for many generations. So you age them when you grow them in the incubator and let them keep dividing. So stem cells, in this study showed that stem cells from older donors have defective functions, including their impaired capability to proliferate and differentiate when compared to cells from younger individuals. And when you look at function of bone marrow-derived stem cells isolated from young mice, 1 to 2 months old, versus old mice, 20 to 24 months old, the bone marrow stem cells from old animals had significantly less capability for differentiation. And when you transplant young bone marrow stem cells, it delays the decrease in bone densities. But what's really fascinating is that if you transplant old bone marrow derived stem cells, it can actually accelerate